I think it's fair to say, and I'm almost 50 years working in healthcare, both in America and overseas. This is by far the most challenging period I have faced. I could not choose just one crisis. Forced to do so, though, I would say workforce is always been a harder issue in rural Wisconsin than the rest of the state. And now we actually have two workforce crises. We have a short-term one that's directly derivative, I think, from current inflationary times, and that manifests itself with a lot of CNAs leaving for easier work at fast food chains, and then creates a whole bunch of systemic problems. Also, due to what was a horrific period for so many healthcare providers, we just lost a fair number to early retirement. They were just burned out. They were tired of the double shifts, tired of being yelled at, tired of a whole bunch of stuff. But that's, I'm going to argue, is not the biggest workforce crisis we face. The biggest one we face is, unfortunately, people like Jim and I are increasingly an anomaly, that we don't believe in retirement, but baby boomers are retiring in increasing numbers. And unfortunately, as we age, we not only retire, but we also use healthcare at 3, 4, 5, 6 times greater rate. You combine those two pieces of data together, and you get the results that George will talk about. I think the DWD results are already mentioned. So we're talking, I chose a different year, 2030, 17% gap in RNs. Well, that's like tomorrow, 2030. That's not some abstract future date. And I know from George's data that it isn't just nurses that will have similar high double-digit gaps, but it will also be most, not all, but most of the other professions. That level of shortfall will make the challenge we had last winter when our system was in free fall look like child's play. So the crisis is not yet upon us for the long-term workforce issue, but that train is coming at us real quick.
We have a very immediate problem, and workforce is really the root cause, if you will, of so much that is going on in challenging healthcare right now. There's a workforce connection to just about everything in healthcare. The cost of producing healthcare, the cost of purchasing healthcare, access to healthcare, and I can give you a great example of what I'm talking about there. But I'd say it's even deeper than expanding educational capacity. It's deeper than interesting or getting to that future workforce earlier and getting them interested in the healthcare profession, because all industries are competing for what is proving to be a finite supply of workers. In healthcare, it's coming at a time when demand is only growing. Can't legislate demographics, not exactly. So I think it's a deeper problem. We have to continue working to find ways to make Wisconsin an attractive place to come and live, raise a family, get a job, get a career, and stay here. We can expand the educational capacity all we want, and that will help. But if we don't have people in this state to fill those chairs in those nursing schools or in these tech schools, then it's not going to make a whole lot of difference. So I think there's while we're looking very at the very immediate, channeling my Jimi Hendrix here. I was listening to it last night, so. But I do think that there's a deeper issue here, and I know Jim and Competitive Wisconsin and Be Bold have been trying to take a look at this issue for years, but I don't think we can overlook that. But there's clearly an immediate problem, and I think there's things we've done and more things that we can do from both a pathway perspective, getting more people into healthcare and into that educational system, but also better utilizing and more efficiently utilizing the healthcare workforce that we have today. That includes things like top of license practice. That includes things we can address through public policy, regulatory policy. So there are things we can do immediately, or more of immediately, and hopefully we'll have a chance to talk about some of those things later.